Thank you. What if there was a way that we could lighten the load of our overburdened healthcare system while helping patients feel supported and lowering overall medical costs? In 2022, I received a life-threatening diagnosis, triple-negative breast cancer, a rare and aggressive cancer. That day, I was shocked, scared, and confused. Even though it was very urgent to me, it took the cancer center a week to call me back. Throughout this 18-month experience, I've been forced to learn a lot about our healthcare system. As a result, I've become very passionate about integrating coordinated healthcare into our mainstream US medical system to lower cost and to connect people with their healing. Coordinated healthcare is a patient-centered approach. It emphasizes collaboration and communication for the most effective and efficient treatment specific to each person. This might include a patient being clearly and thoroughly informed of their care options, as well as being included in decisions about their treatment. There is a fluidity of care between primary care providers, specialists, pharmacists, and other medical staff, and even complementary care, like acupuncture or massage. The focus is on overall wellness as opposed to focusing solely on the illness. I learned firsthand that not all medical establishments run the same way. My partner had an eye injury the previous year, and the eye facility that served him ran like a well-oiled machine. Each member of the staff had a role, and it was all overseen by an eye generalist. There was one person to communicate with, simplifying the whole process. It was truly amazing to witness. Yet, when I heard the term coordinated care at my facility, it wasn't what I was receiving. Throughout the experience, I had so many questions that went unanswered. I wanted to talk about what caused the cancer, alternatives to dealing with side effects, and how to prevent this cancer from recurring. Sometimes the doctors became frustrated and even angry that I was asking so many questions. Sometimes I received conflicting messages. One oncologist telling me that I don't qualify for medication, and another in the same office telling me that I do. This frustration and the overall costs of my treatment, nearly $500,000, led me to realize that there are some solvable issues within our healthcare system. While coordinated healthcare is not a new term in the United States, it's not always done. It's not about the lack of competence in the staff, lack of universal health care, or the overall high costs. It's about the inefficiencies of the system and the lack of cohesion. Despite being white, well-educated, and English-speaking with comprehensive health insurance, I encountered challenges in navigating my treatment. People undergoing some cancer treatments typically experience brain fog. They need someone to help them decipher medical details as well as the billing. I was fortunate that my partner could help with all this, but not everybody has that luxury. What if I were an immigrant who didn't speak English or was uninsured? Would I have gotten the same care? With my specific cancer mostly affecting people of color, this is especially relevant. It hasn't been all bad, though. There were some wonderful things about my care. The doctors were competent, the nurses were helpful, and the patient portal allowed me to message doctors, update medication, and see my testing as soon as the results were available. I'm very grateful that my body is now cancer-free. Don't y'all make me cry. Yet, in hindsight, I realized that there were some things that could have been done to make the process go much more smoothly. Coordinated healthcare bridges gaps. It helps to create and implement a universal technology so that all providers can interact efficiently with the patient. The provider knows who needs preventive care, and it makes easier medical access for more people. Research tells us that the relationship with our provider makes a difference in the outcome of our care. With cancer and other chronic illnesses, that's why it's so important for the doctor to develop a level of trust with their patients. Something as simple as using a person's first name, being prompt, maintaining eye contact instead of looking at the computer, and speaking in a way that the person understands. With coordinated healthcare, hospital and emergency room visits decline by 37% because all of the patient's needs are being handled by their team. Coordinated healthcare increases communication and patient safety. The patient knows what to expect, and when they know what to expect and whom to reach out to with challenges, they are empowered and they can take a more active role in their health. Coordinated healthcare decreases fragmented care, which is seeing a variety of doctors who are not communicating, which often leads to poor health outcomes. Fragmented care is roughly twice as expensive as coordinated care. So we need an entire system overhaul. Yet system-wide change can be challenging. We can, however, start with some smaller, low-cost changes. First, a coordinator. There are many people available, medical students, retirees, and volunteers who could make this an affordable option for our medical establishments. Yes, it would take time to train, schedule, and oversee these people, yet empowering people through their healing process would make it worth it, not to mention the cost savings that I mentioned previously, and allowing doctors to spend more time and to be present with their patients. During my partner's eye treatment that I talked about earlier, he was able to connect with his coordinator whenever he had any questions or if he needed to know his next step. He felt like he was really a part of his healing. Second, advocacy. Teaching patients and their caregivers self-advocacy skills is key. Show them that they can be a part of their wellness and their healing. Let them know it's okay to ask questions. Ask how much things are going to cost and what they can and can't do, including things like diet, movement, medications, and dealing with side effects. My partner and friends advocated for me when I couldn't speak up for myself. Third, simplify and lower costs. I had to sign a document before each treatment saying that I understood what the costs were, yet I never, not once, was told what the costs were going to be. We could have a flat fee per diagnosis so people know beforehand what it's going to be. There could also be bundled services. Doctors are typically paid by how many people they see, not how effective the care is. So while some of these changes might increase some costs, patient satisfaction will rise. And as I mentioned earlier, some of the costs will be decreased, like over-medicating and repeat testing. So, if you or a loved one receives a diagnosis, here are a few things that you can do. Speak up. Ask for what you want and need. Make sure that you clearly understand everything that is being said and done to you. Help with rides, accompany loved ones to appointments, ask questions, take notes, and help with both the billing and insurance company. volunteer, help with rides, food, and cleaning, set up an online calendar for family and friends and food deliveries. This was something that was very helpful during my treatment. Embracing coordinated healthcare offers us solace and clarity for some of our most challenging moments. Whether it's you or a cherished one facing a diagnosis, together we can create a more effective, economical, and simplified path toward healing. Thank you.